Hey everybody, Dr. Holly here. Happy 5-minute Friday. I'm setting my timer right now so I make sure that I don't go over 5 minutes today. But today I'm coming to you with a little bit of a different message and a little bit of a different hat on. I wish I literally had a hat. The very specific color I'm going to show you in just a second. But my question to you today is, do you see Medicare patients? Okay? Whether you do or whether you do not, I'm going to explain to you today why advocacy matters. Now, this is a completely different subject line than I usually present, but I'm all fired up today because today is the ACA's lobbying day. I'm recording on Thursday, May 6th, to send 5-minute Friday to you on time on Friday. And today is our lobbying day. So I spent the morning back-to-back Zoom sessions with both of my Congress, or one of my congressmen and two of the senators for the state that I live and practice in, talking about this Medicare bill and what it means to us as the chiropractic profession, as providers in the healthcare landscape today, what it means for the opioid epidemic, etc. Okay, so this is why I'm talking to you about it right now, because I'm all fired up. So this is the deal. Whether or not you take Medicare, you're probably aware of the fact that Medicare doesn't really, quote, like chiropractors, right? We don't get reimbursed to our full scope. We only get reimbursed for a very narrow subset of diagnosis codes and only for spinal manipulation, okay? You guys know this, but guess who doesn't know this? Our legislators. Congress doesn't know this. For most of the aides that work in congressman offices, they just do not know this information, that this is a law that was passed almost 50 years ago, okay? To get us into Medicare, they intentionally made it very narrow, okay? But what we've come to know is that we're vital and essential members of the healthcare landscape, of individual patients' healthcare needs, right? So the ACA has worked very hard over more than the past decade, but at least I know I've been vitally aware of what the efforts they've been making over the past decade to get a bill introduced. It was introduced in the last Congress, got 91 co-sponsors. We need like 250 for it to pass. So it's been reintroduced just a couple weeks ago. We're up to 19 sponsors as of this morning. So it's bipartisan. It's been 50-50 pretty much right down, Democrat, Republican, everybody can get on board with this. Why am I talking about this? Well, even if you say, I don't see Medicare patients, I'm a cash practice, I'm a this, I'm a that, whatever. Okay, it doesn't mean that Medicare patients don't exist. It doesn't mean that it's not vitally important for us to have parity, for us to modernize this bill, okay, for us to be seen as equals with other healthcare providers that have the cultural authority to see this patient population, okay? Medicare sets the stage. A lot of private payers will set their fee schedules or reimbursement schedules, everything else based on what Medicare does or does not cover, okay? Now, have we seen those changes in the last 10 years? Not really. A lot of payers have been playing around with different reimbursement schedules and going towards per diem or per case models, etc. But what we know is that if we can get into Medicare, we can start to see bigger impacts and have more data to follow on what exactly we provide to the healthcare landscape as doctors of chiropractic, okay? Guess what? If you want to integrate, we have to have parity. I know that some of you have had experiences in settings like in the VA or in hospital-based settings, but guess what? Unless we can get full scope reimbursement, we are going to be stopped dead in our tracks. And I have personally had experience with this where I was going to be hired on in an integrated model, and the buck stopped at the fact that primarily it was going to be a Medicare population, okay? And if they can't make money on the services we provide, then that's not going to be a line offering that they're going to do. And so where are these patients going to go? Going to see more PCPs, going to see more PTs, going to see orthos, going to see neurosurgeons, etc. We get left off of the table. So why am I talking about this? How does this matter to Dr. Holly, Profit Coach, Profit First? It's your cost of doing business. I list this as putting your essential cost of doing business is at least paying your dues for your state and national associations, because they are protecting your licenses day in and day out for you to have a livelihood, for you to do what you do. You don't have to be a leader. You don't have to be the one on the stage making the announcements, seminars and stuff like I was doing this past weekend. You don't have to be the one on the Zoom call talking to your legislator. I sure love if you would be, but guess what? I like doing this stuff, so I'm going to do it. But I need you to support your state and national associations, support our PAC, so that we can make these changes on the Hill. Even if you're a cash practice, even if you never see an insurance patient, even if you don't like dealing with the elderly population, I get it, okay? But this is just my soapbox for today. If you want to hit reply in the email and let me know what you think about this, because it will impact all of our bottom line. I think it will make or break this profession in the next decade or two on whether or not we have parity and whether or not we are deemed essential year over year, okay? If we can't fix this, where are we going to go? My timer's going to go off. Have a good weekend, everybody. See you next week.